Will my insurance cover prenatal care as well as a birth with a midwife?
Will my friends have access to a doula or a midwife?
When I give birth, will I even be able to afford a midwife or a doula?
Will my friends have a choice in whether they have a natural birth or not?
Is it possible to give birth without unnecessary intervention?
In the United States, hospital births are the norm, but statistically, hospitals may not actually be conducive to positive birth outcomes. With 90% of births occurring in hospitals, over a quarter of them being C-sections, the United States still has the second highest infant/maternal mortality rate when compared to 33 other similar countries.
As well as systemic societal barriers prevent millions of families from accessing birth care that has been proven to promote positive outcomes.
Access to doulas and midwives promotes better birth outcomes for both mother and infants. But there are disparities in who is receiving this care.
Natural birth is like when it's sort of like an at-home birth where you don't use any type of medication.
A birth where you're at home and someone is helping you give birth and there's not, I guess, any like medicine involved.
Birth is like giving birth without any form of like anesthetic or like C-section, and like I don't know if it necessarily counts as like being in a hospital isn't natural birth, but just as long as you're not using any anesthetics or like medicine to help dull the pain or like any kind of procedure to like not interfere but change the procedure from how it would go natural.
I think a natural birth means that you don't use any chemicals or medicine.
I think it like painful, not fun, but at the same time I feel like it could be like a really good bonding experience with like the child and like in your home.
Well, in societal terms, I guess it just means like when somebody comes out of the vagina instead of being cut out of somebody's uterus.
When thinking about birth outcomes, low birth weight, and what happens kind of in the labor room. So there have been research studies that have shown that if a doula is present, even if she's sitting on the side not doing anything, that the birth outcomes are better just by her mere presence. And if she's more hands-on, giving more support, emotional support, that the outcomes are even better. But in general, having a person that's not a family member present and that's not a medical staff has been shown to reduce cesarean rates, reduce episiotomies, less epidurals, less reported pain, and more satisfaction with their birth. Everybody had a doula. To me, would make it feel like mothers and the families are empowered to have the birth experience that they want. If things don't go right, the doula is really there to talk about the birth story and kind of help with any birth trauma that might have happened. So one example that often gets used is when a pregnant woman's in a grocery store or a pregnant individual's in a grocery store, a lot of people will come up to her and say, oh, what are you having? Oh, make sure you get an epidural. Or, oh, my birth experience was this, that, or that. And the problem with it is that no one's ever asked her what her birth story was. Once the baby's born, people come over and they say, where's the baby? And it becomes about the baby, and no one ever asks how mom is doing or how the parents are doing. They focus on the baby, and her story gets lost. And so the only time for her to tell that story is when she sees someone who's pregnant. I love being a doula. After every birth, I say that's my last one because I'm so busy. But I always find a way, after the month wears off and I get my sleep and I eat, then I'm like, oh, where's the next baby? Where's the next mom? So I really love it. I'm pretty sure I'll be doing it for the rest of my life.